Taoiseach, the House, I think, will be united today in anger, shock and horror at the revelations in the primetime programme Bungalow 3 last evening. And I want to commend RTE and Primetime for an excellent example of public service broadcasting at its best. But the revelations were truly shocking, and they represented clearly violations of human rights of senior citizens with intellectual disabilities. These citizens, Ivy McGinty, Mary Garvin and Mary Maloney, among others, had their basic human rights violated to an extraordinary degree. They were subject to torture, to physical abuse, to emotional abuse, and the treatment was, without question, degrading. They were kicked, dragged, and shouted at times, and not allowed even to attend to the basic necessities of life, which was revealed harrowingly in the programme itself. And I think there are many lessons to be learned from it, Taoiseach. But the first point I would make, and I know that Minister Lynch did say to the programme that she couldn't give an assurance that this type of behaviour was not happening in other centres. I would put it to you, Taoiseach, that we need to give that assurance, and government needs to work very quickly in terms of devising an action plan in terms of every centre to make sure that we can give that assurance to other relatives of people with intellectual disabilities in other similar centres across the country. Professional staff should be recruited. It has emerged that the staff in Bungalow 3, for example, had at most 10 hours training, which in itself is disgraceful. And you could see that from the programme itself. The culture that was allowed to fester in Bungalow 3 should be wiped out completely. And I want to ask Taoiseach, and I would put it to you, that the relatives, and I feel for the relatives more than most, because they trusted the HSE, they trusted people to care for their loved ones, people with severe intellectual disabilities. And that trust has been breached. It's clear that we need an independent inquiry into Áras Attracta, separate from the HSE and indeed even from HEQA. An independent inquiry, Taoiseach, into what happened and the culture and practices that went on there, so that we can learn lessons from the future. And secondly, Taoiseach, in June 2011, there was a report published, the Congregated Setting Working Group, which fundamentally challenged the existence of these congregated settings.
Thank you, Deputy.
And basically made the point, and I'll be finished now, Count Corlett, congregated provision is in breach of Ireland's obligations under the UN Convention. The provision contradicts the policy of mainstreaming, which is in the National Disability Strategy and so forth. And it's at the time the ethical case to move people from isolation to community, and in some cases from lives lived without dignity, is beyond debate. Now, we recommended about 32 recommendations in that report in June 2011, and I believe an international implementation group was established. I'd like to ask you, Taoiseach, can you outline the progress in implementing those 32 recommendations? A 7-year plan was outlined for the implementation of the recommendations, which involved all the stakeholders, all the groups working with the HSE, and it said that the case for taking action now, and this is back in June 2011, to address the situation of people living in congregated settings is powerful and unassailable, and particularly the ethical case to move people from isolation to community. Could you outline to the House the progress made in relation to the implementation of those recommendations, and my question in relation to the need for an independent inquiry?
First of all, I have to say that last night was another example of what we had in Lees Cross some years ago. This was frightening, was sickening, was infuriating. People legitimately asked questions: how could this happen in 2014 with trained nurses, with healthcare workers qualified to FETAC level, to FETAC level 5? But it wasn't an example of care, I can't call it. It was an example of control over fragile, vulnerable, voiceless people. I found it absolutely sickening. The situation here is that following a HIQA inspection early in the summer. 59 recommendations were made to be implemented, and they have all been implemented, including 400 hours of training, and there were 100 hours of that 400 allocated here. There are a number of investigations going on at the moment, as Deputy Martin is aware, including the fact that the television coverage, in respect of which I've commended RTE, has all been handed over to the Gardaí. I don't want to say anything here that may prejudice in any way the outcome of those investigations or whether or not criminal prosecutions will take place. But the rights of these defenceless, voiceless people were trampled upon. This is not an example of any kind of standard in terms of care and consideration. It was an example of control. All of the chief executives of all the service providers are being called together next Tuesday. As you're aware, the chief executive of the health service executive wrote to everybody. They're all being called together next Tuesday because the question being asked is this an isolated incident? Can we be assured that this has not happened, does not happen, and is not happening in any other centre? Now, the report that was written by Mr. Christy Lynch, the chief executive of Care, and who independently chaired the review of the services, is an acknowledged, genuine expert in this field, and his services are quite exceptional, I have to say. I think, Deputy Martin, we can't afford to have any loss of concentration on what happened here. This is absolutely disgraceful. Now, I think it's appropriate that the health service executive call all those chief executives together early next week. But I think it's also important that the investigations that are underway be concluded quickly in the interests of everybody, both those in Áras Attracta, some of whom I know, and their families. And I made the point yesterday, Ciancola, there's so many genuine healthcare workers who have pride in the job that they do, have their names and their reputations damaged by what happened here. I don't rule out what you say in terms of investigations, Deputy Martin, but I think it's important that the investigations that are currently underway be concluded, that we have the opportunity to discuss them here, but that the HSE and the department and the ministers involved see the outcome of these. And as I say, I don't want to prejudice anything that might arise from the investigations that are currently being conducted by the Garda, Ciancola.
Thank you. Deputy Martin.
Taoiseach, I'm somewhat disappointed with the response. I think there's a compelling need for an independent inquiry, and one could be established that would not jeopardise any criminal proceedings, because there are very fundamental issues that go to the heart of what happened at Áras Attracta that need independent investigation separate from the HSE and indeed the Health Information Quality Authority. Absolutely, Taoiseach. I think the government should move on that, and I would ask you to consider that as an important response of substance to the revelations in yesterday's prime time. And I think nothing less will suffice. There's been a fundamental breach of trust, Taoiseach, and that trust can only be restored by a fully independent inquiry into what happened. Secondly, Taoiseach, in terms of assurances for other centres, similar centres across the country, I do not think just calling the chief executives together next Tuesday to ask them, is everything okay, is sufficient either. I've no doubt most of them will say, yes, it's grand. The bottom line, if we've learned anything from the revelations yesterday, is that we cannot take any glib assurances that things are grand and fine in a particular institution. So I would have thought that an action team would have been established with resources to actually now go to every centre in the country, similar to Áras Attracta, and to do a very thorough examination of practices and culture, to give that assurance to relatives and indeed, obviously, to affirm the basic human rights of people living in other centres. And I'm not in any way casting aspersions on the very hundreds of good staff out there that are doing good work. Thirdly, Taoiseach, you didn't address at all my question, perhaps the most important one, in relation to the report of the Congregated Settings Group. That report is fundamental to last night's programme, in the sense that it is recommending that the country should move from congregated settings to a community model over a 7-year period.
Thank you.
And it says very clearly, Taoiseach, The working group took the view that the case for taking action now to address the situation of people living in congregated settings is powerful and unassailable. The ethical case to move people from isolation to community and in some cases from lives lived without dignity is beyond debate. So that report, which involved everybody, in 2011 said to live beyond dignity or to live without dignity, to move people from that situation is beyond debate. Can I get from you, Taoiseach, some sense of the progress in terms of the 32 recommendations of that report? Where are they now? And can you outline what progress has been made?
Thank you.
They're all in progress, but basically...
Taoiseach?
Yeah, I think you raise a number of Christy Lynch actually wrote the Congregated Settings report. I don't think anybody can question his either experience or independence. I think he's, he's actually written. He wrote the Congregated Settings report. Now, no more than so many other things, Deputy Martin. The capacity to implement that report in terms of the economy and the shortage of housing, it just hasn't happened. Unfortunate reality. I don't think that you would argue.
Sorry,
I don't think that you would argue with the report itself, and it was written by somebody who's.
Sorry, we have a time limit here.
It's being moved along, but it's not implemented clearly. Mr. Lynch is the former vice chair of the Equality Authority. He's the former chair of the Federation of Voluntary Bodies. He's the project manager of the Congregated Settings Review. And that's being implemented, not to the extent that one would like because of that issue. There is an action team in there at the moment. 3 people brought in from outside the country. The head of that is the person who's really experienced in terms of dealing with challenging behaviour in different settings. And this is, as you can understand, quite complex. It's not a case of wanting to say here's an answer by calling the chief executives together. Minister Lynch pointed out, can we be sure that this is not happening or hasn't happened in some other location? And clearly, every chief executive, every manager in these positions has a duty and a responsibility to see that, in respect of the facilities that they're in charge of, that this doesn't happen. Now, I've listened to Mr. O'Brien this morning talking about the need for the possibility of continuous undercover agents or whistleblowers and all of that. Yes. I think actually, let's have the opportunity to have a far more detailed discussion in the House here about these matters. That you can have an up-to-date, detailed report from the Minister about this as it moves along. I certainly don't object to that in the interest of information for everybody. It is a matter of really deep concern to us all personally, Deputy Martin.